Welcome back to the show. I am Dr. Khan, and I'm joined by the walking medical encyclopedia, Dr. Sarah. Today, we're diving into one of my favorite clinical physical exam findings, Froment sign. It's that moment in the clinic where a simple piece of paper tells you exactly what's happening deep inside a patient's hand.
It's a classic for a reason, Dr. Khan. For the boards, Froment sign is high-yield gold. It's the definitive way to test the integrity of the ulnar nerve, specifically looking at the adductor pollicis muscle. If you see this on an exam, they are testing your knowledge of nerve-muscle relationships and compensatory mechanisms.
Exactly. I always tell my students, imagine you're trying to hold a winning lottery ticket and someone is trying to pull it away from you. You need that strong pincer grip. But if the lead actor muscle isn't showing up for work, the understudy has to jump in, and that's where things get weird. But before we get to the sign itself, Sarah, give us the precise anatomy of the muscle in question.
The star of the show is the adductor pollicis. It's an intrinsic hand muscle with two heads, oblique and transverse. Most importantly for exams, it is innervated by the deep branch of the ulnar nerve, which carries fibers from C8 and T1. Its job is simple. It pulls the thumb toward the palm or adducts it, allowing for that powerful pincer grip against the side of the index finger.
Right. So why does this matter clinically? Well, think about a patient who comes in after a glass cut injury to the wrist, or maybe someone with a late-stage entrapment at Guyon's canal. They can't adduct the thumb properly because that ulnar nerve is out. When I ask them to hold a piece of paper between their thumb and index finger, the paper test, they physically cannot use the adductor pollicis to keep that paper flat.
And that is where Froment sign actually appears. When the patient tries to grip the paper to prevent you from pulling it away, they realize the thumb is slipping. To compensate, they recruit the flexor pollicis longus, or FPL. Because the FPL is innervated by the median nerve, specifically the anterior interosseous branch, it's usually still working even if the ulnar nerve is damaged.
And here's the analogy. It's like trying to close a door with a broken handle. If you can't turn the knob, you might try to kick the door shut instead. You're achieving the goal of holding the paper, but you're doing it with the wrong movement. The FPL flexes the interphalangeal joint of the thumb. So instead of a flat thumb pressing against the paper, you see the tip of the thumb curl into a hook.
That hook, or flexion of the thumb's distal phalanx, is the positive Froment sign. If you see that flexion, you know the adductor pollicis is paralyzed. Board examiners love to ask which nerve is responsible for the compensation. Remember, the sign is positive due to ulnar nerve failure, but the action you are seeing is a median nerve action.
It's such a clever trick of the body. But Sarah, let's dig deeper. Why does this matter clinically beyond just making a diagnosis? If a patient loses that adductor power, they lose the ability to perform fine motor tasks, buttoning a shirt, holding a pen, or using a key. They become frustrated. As their doctor of choice, you need to be able to explain why their hand is cheating by flexing the thumb.
And we have to distinguish this from other pathologies. For example, in the boards, they might try to trip you up with Jean's sign. That's when you see hyperextension of the metacarpal phalangeal joint alongside the IP flexion. Both indicate ulnar nerve palsy. Dr. Khan, how do you explain the difference in grip to a patient?
I tell them their hand has lost its power vice. The adductor pollicis is the muscle that provides the oomph in your grip. Without it, you're relying on the flexor muscles, which are meant for different tasks. It's inefficient. It's like trying to use a pair of tweezers by bending the tips rather than squeezing the sides.
That's a great way to put it. For those prepping for the USMLE or COMLEX, remember the deep branch. The ulnar nerve enters the hand through Guyon's canal, and the deep branch is almost entirely motor. It travels across the palm to reach the adductor pollicis. A lesion at the elbow or the wrist can both cause a positive Froment's, but you'll need to check for sensory loss in the pinky to localize where the nerve is pinched.
Great point. If the ulnar nerve is gone, you might also see hollowing of the space between the thumb and index finger on the back of the hand because the first dorsal interosseous muscle wastes away too. It's a whole ulnar package, but Froment's is the most visual, most dramatic part of that exam.
Exactly. To wrap up the high-yield points, adductor pollicis is ulnar nerve CAT1. Froment sign is a positive finding when the thumb IP joint flexes during a pidge grip. This happens because the flexor pollicis longus, median nerve, is compensating for the paralyzed adductor pollicis.
Perfect. Why does this matter clinically? Because it allows you to diagnose an ulnar nerve lesion in 30 seconds with nothing but a business card or a scrap of paper. It's bedside medicine at its finest. Thanks for the deep dive, Sarah.
Anytime, Dr. Khan. Just remember, if the thumb tip bends, the ulnar nerve is on the ends. See you next time.